Hi everyone, hope you're all doing really well. This lecture is going to be on paediatric radiography, so I hope you enjoy learning about the speciality within radiography. I spent the last about 8 or 9 years in paediatrics in Manchester and then in Glasgow, so it's something that I'm quite passionate about, and it's really good for you guys to get an overview of paediatrics before you go on and do your placements there in third year. So I've broken this talk into 3 sections just because it can be quite a heavy topic because a big part of paediatrics is child protection. So that is towards the end. The first part is really just about an intro to paediatrics. Then we're going to look at some pathologies in the second part, and then we'll look at the role of the radiographer within child protection. Okay, so by the end of this talk, hopefully you'll be able to demonstrate an understanding of the role of the radiographer within paediatrics, and that doesn't have to necessarily be at a specialist paediatric site. That could be at a district general hospital that also x-rays children as well. Hopefully you'll understand and be able to name some common paediatric pathologies. You'll be able to discuss maybe some common imaging techniques that we use. You'll have a much greater knowledge, hopefully, of why we use radiation protection, why it's so important within paediatrics. And then also, we really do want to stress the importance of the radiographer, not just the paediatric radiographer, but the radiographer in any setting within child protection. Okay, so the first part is this intro to paediatric radiography. So it's going to be an overview of paediatric imaging and the techniques and skills and qualities you have to have to be a paediatric radiographer. Okay, so you might be thinking to yourself, well, why do I have to learn about paediatric radiography? You might be thinking children, cry and they're sticky and they ask too many questions, and that is all true. But also children are really fun and they're really resilient, and children really don't know sometimes how unwell they might be and really just want to enjoy most moments. So actually working in paediatrics is very, very rewarding, and it can be a really fun place to work despite some of the sad things that you might see. So it might be that you want to specialise in paediatrics. Down south you can specialise as band 5 is what I did. I went down south, or in Glasgow you have to be a band 6. So it really just depends maybe what you want to do with your career. But even if you don't specialise in paediatrics, it is highly likely that you will x-ray a child at some point. Maybe not so much within the city centre of Glasgow because we do have the Children's Hospital, but even if you go out to other sites, maybe down in Ayr or other sites within South Lanarkshire, you do end up x-raying children. So it is important that you have the basics to know how to do that, and also that you are able to communicate effectively with children, because that is the most important part. Then on to child protection. So even if you have no interest in children and you'll never work with them, and I do have friends who would say, I will never ever work in paediatrics, it's my idea of hell, and that's totally fine. But you are still, as a health professional, you do still have a responsibility in terms of child protection. You do have to be able to look out for the signs and know the steps to take if you are concerned about a child's well-being, okay? And then also transferable skills. So although you might not be interested in x-raying children, although I hope some of you are, the skills that you learn with children are very much transferable to vulnerable patients, maybe the elderly population. I kind of think if you can work with children, you're working from neonates right up until the age of 18, so you should have very, very wide range of not only radiographic skills, but communication skills, emotional intelligence, all of that kind of thing. And that's all transferable to lots of different situations. Okay, so essentially the aim of paediatric radiography is to have a happy child, but that isn't always the case, because not all children will be in a happy place. They might be in pain, they might be going through some difficult things such as treatment. So although we would like to have a happy child, it's not always possible, but you should always be aiming for that. Make the procedure as pleasant as possible for the child and for the parents. So This is quite different from adults, where you're not really dealing with other people, you're just dealing with the patient. In paediatrics, the parents are very much involved, quite rightly, with the procedures, and they play a big part. So you really want to get them on your side as well, because that makes for a much easier experience all round. You want to be happy in your job as a radiographer. You don't want to be you know, finding things difficult all the time, so you have to find ways to make the job easier for yourself. You want your radiologist to be happy with your standard of images, because you want them to be of a high diagnostic quality. So that's kind of what, you know, you should be aiming for. Not saying that you go in every day thinking I'm going to have a happy child, happy parent, happy radiographer, happy radiologist, but you know, overall you should be aiming for these things as a paediatric radiographer. Okay, so I'll just move my camera a little bit over here so you can see. So the paediatric environment really begins, as you know, it's right at the beginning. It has to be welcoming. So as soon as the patient walks into the imaging department, they shouldn't feel intimidated. They should feel that this looks like a fun place for them to be. You know, there should be different areas depending on patient's age. So within the hospital in Glasgow, they've got like a foosball machine. They've also got an area where they can play on their iPads. They've got an area, I think they actually have a pool table now. I might have that wrong. They did have a pool table at one point, but then they've also got, you know, a soft play area for the younger children. They've got those little cars that kids scoot around in at your feet. So it's a fun place to come as a child. And quite often, actually, some of the children who are inpatients at the wards, you would maybe walk past them at 8 o'clock at night as you're leaving, and the kids are just playing in there because it's actually a good respite for them from the ward. So yeah, the paediatric environment essentially should be something that's really welcoming, fun. The people should be friendly. I can't stress that enough. This should be the same for even adults hospitals, but especially in children's hospital. When somebody comes to the desk for an x-ray, they're already anxious, the parents are already anxious, and they should be greeted with a friendly face and somebody who's helpful and kind, and not somebody who's grumpy. So that's really, really important. Okay, so this is the Royal Hospital for Children in Glasgow. So you can see up the top left, there's like the kind of computing part, and then we've got a foosball table, and we've got the soft play area. So it is a really fun, interactive place for the children. Okay, so your paediatric team. So working in a paediatric hospital, you work very, very closely with other members of the interprofessional team. So you have obviously your radiographers, who are band 6 in Glasgow, band 5 down south. You work very, very closely with your radiologists. I've found that paediatric radiologists are always very approachable and, you know, generally just really helpful, nice people. I don't know if that's because people who are attracted to paediatrics tend to be maybe a little bit more fun, or maybe a little bit more approachable, or maybe not, who knows. But yeah, you work very closely with radiologists. Your healthcare support workers play a really big key role kind of with immobilising children and things like that, or distracting children. You also work really closely with the anaesthetist. We're not going to talk so much about that today because we don't tend to use GA scanning for, well, we never use it really for x-ray. It's something that we use for MRI scans, nuclear medicine scans, sometimes CT scans, but not as much. So we won't talk so much about that today, but just know that you would be working really closely with anaesthetists, because children often go under GA to have an MRI scan. And in the same breath, you'll be working with an anaesthetic nurse or an operating department practitioner. And not so much in general x-ray, but if we were an MRI, you'd be working with a medical physicist quite closely as well to have optimization of your protocols. Okay, so I feel like I'm going to be moving this around a lot. The qualities of a good paediatric radiographer. Well, the very first one that comes to mind is patience. And I can almost hear my husband laughing in the background because I'm not a patient person at all. But when I work with children, for some reason, that comes out of me. And maybe it's because children obviously, you know, are more vulnerable and they don't really realise they're sick, and they, not that it's anyone's fault that they ever get sick, but it does feel like children, maybe you just have more patience for them because they are more vulnerable. So being patient is a very big quality, a very important quality to have. Children, you know, they don't really listen if they're younger, they can be quite upset, they need a lot of coercion and patience to maybe get the x-ray done or whatever modality they're in. You also have to be a team player, so you have to be really willing to work with other members of the multidisciplinary team, also with your fellow radiographers, healthcare support workers. It really is like a big family at the Children's Hospital, and everyone's really trying to help each other out. You also have to be a problem solver, so adaptive technique does play a big part. You're always thinking about, well, how can I get this x-ray if this child is moving around? What angles do I need to put on if this child can maybe put their arm in the position because of a cast? All that kind of thing. Being a good communicator and a good listener is probably one of the most important things. As I said in the beginning, you're working with children from, you know, neonate right up to 18, and then you're also working with their parents. So if you can't communicate well, then you're probably not going to be able to do the job very well. Empathy and kindness is a really important part of being a radiographer, no matter what age the patient is. But obviously working with children, you have to be very empathetic towards their parents. You know, this having to x-ray someone's child, even if we think, well, oh, it's just a finger x-ray or whatever, it's really important to them and it's really difficult for them. And we really always have to be mindful of that. We have to be creative. So, you know, think of fun ways to get a child on board. We'll talk a little bit about that further on, but think of fun ways for them to be part of the experience so that it's less intimidating. And then a really important one, which I think all paediatric radiographers have struggled with at some point in their career, is that ability to switch off. So you are faced with really sad cases sometimes, whether that's a child going through cancer treatment, whether that's a child who's under investigation for child abuse, you know, or maybe it's when you're doing a post-mortem x-rays, so the child's already passed away. So there is definitely things that can take their toll on you. So it's really, really important that you try your hardest not to take that home with you every night. Now that isn't always easy, but I do know that it does get easier the more you have experience. So when I first started in paediatrics, when I worked in Manchester and I did my first post-mortem child who had been abused, I was said to my colleague, like, I'll never get used to this is going to haunt me. And I never got used to it, but I was able to kind of process it after the 4th, 5th, 6th time. I was able to maybe compartmentalise it. And we did have times where we could speak to people in confidence, obviously without naming any patients, but just speak to people about how we were feeling to try and sort of reflect on the situation and navigate through it. But it is really important that you're able to find different ways to switch off. And that's the same for when you're working in adults as well, because you do see some really difficult things there as well. Okay. Okay, so within paediatric practice, there are certain essentials that we need to consider. So we'll go through them in some detail. So preparation, immobilisation, cooperation, and radiation protection. So we'll start by looking at preparation. Okay, so preparation really begins in the waiting room. So as I said, you want your child to come into, your patient to come into a welcoming environment. You want them to really not be intimidated from the get-go. So it starts really when they walk through the doors of the imaging department with the staff member who they might meet or the healthcare support worker they might meet on their way. So really preparation does start from the very, very beginning, because if a child comes in and they already feel anxious, the last thing you want is for that to be exacerbated. So you want them to come in and try and make them feel at ease. So if they have these fun activities prior to coming into the x-ray, they already feel that this is a fun place to be. Now obviously that's dependent on the child's age. If the child is 16, you know, we can't, and they're grumpy or they're not happy or they're in pain, you know, that's much more difficult to sort of navigate. But if they're maybe a young child, 3 or 4, we really can make it a fun environment for them. As I said, we want happy, welcoming staff. You want to avoid delays if possible. So the last thing you want to do is forget to really read the request or whatever and get the patient in and then realise that there's an issue. You want to be on top of all that stuff before the patient ever comes into the x-ray room. So you want to have contacted any people you have to contact. You want to have looked at packs for previous imaging. You want to look and see if they've had any previous x-rays recently. All of those things should be done before the child comes into the x-ray room, because children don't have any patience, and you've only got their attention for a very short period of time. So make sure that you're on top of all that. You also want to have a plan. So if you know that you're x-raying their wrist and it's in a cast, start thinking about what you need to do to make that possible. Start thinking, well, what age is the patient? Am I going to need another member of staff? Am I going to need a healthcare support worker to mobilise the child? Am I going to have to use pads? All that kind of thing should all be coming into your brain before you even get the child into the room. Have all the tools of the trade ready. So that's things like pads, you know, sandbags, your radiation protection. All have them to hand, because it has happened to me before when I maybe have not been practicing what I preach, and I get the patient in, get them in position, and then I realise somebody's moved the equipment that I need into another room. So you don't want to fall into that trap. And also have rewards. So stickers really help, certificates really help to, you know, reward the child for doing a really good job. And they do respond to that as well. Children really do love that, those rewards. Okay, so in terms of immobilisation, it really just depends on the age of the child. Sorry, I don't really know where to put this little camera. Maybe put it up here. Yeah, so immobilisation depends on the age of the child. Obviously, if a child is older, they won't need to be immobilised. They're able to just get in the position and stay in the position themselves. Sometimes children maybe require their parent to hold their arm, or a staff member, maybe a ward nurse or a healthcare support worker, to hold the position. But that's when we have to start really thinking about the impact that's having on the child. So if it's for a very short period of time and the child seems okay with it, then that's fine. If it's for a longer period of time and the child is getting really, really, really worked up and upset, then we have to really start thinking about the impact we're having on them mentally. We have to be aware of previous trauma they might have been through, especially if we're doing, for example, a skeletal survey because they suspect physical abuse. Well, if we're holding a patient down for period of time, that could be very triggering to them if it's something that unfortunately they've experienced at home. We want the child to feel as safe as possible, so sometimes immobilisation can be simple as maybe wrapping them up in a blanket, giving them that kind of cocoon warm feeling, giving them positive affirmations, so tell them how well they're doing, tell them that we're really proud of them, and just speaking in a very calm voice. The last thing you want to do is be a radiographer who's like a bull in a china shop. You really need to be calm. You need to make sure that the patient feels safe, and kind of speak to them almost like a kind of hypnotic mindfulness technique, and that can really help immobilise them and help keep them safe and keep them happy. So here's some pictures just of what we use. So there's some sandbags at the top right hand corner, some pads, some aprons, and some stickers. Okay, so in terms of cooperation, this is when it gets a bit more tricky and it's very age dependent. Communication is the most important thing. We'll talk a little bit about that depending on the child's age. It's all about building trust, but unfortunately it's not just down to you whether or not the child trusts you. It's really based on their previous experiences in hospital. So if a child has felt lied to before, if they've felt that they've had a bad experience, that can really impact how they are with you when they come into the x-ray room. Remember how important it is to acknowledge the parents and the carer and or the carer. And then you really need to have a little bit of understanding of a child's development. So, you know, you don't have to be you know, all knowledgeable about each stage of child development, but if you sort of understand, you know, how the child's brain is working at a certain age, then you can meet them at that development. Okay, so, sorry, I'm now moving down to your left. So in terms of cooperation, we're going to look at how you get a child to cooperate kind of based on their age. Obviously, these are sort of general age ranges. So in terms of neonates and newborns, it's actually quite easy to x-ray them, in the sense that if they're warm and they've had a feed, then usually they're pretty cooperative, because they just want to be warm, they just want to be full. So quite often we'll say, you know, maybe give them a wee bottle before they come down, especially if it's something long like a skeletal survey. Make sure that they feel warm, make sure that they feel full. Non-verbal communication can be important. So, you know, although they are very new, newly born, they are still becoming aware of your face and the sounds that you're making. You might want to give them a dummy if the parent allows it. Sometimes parents don't want to do that, and that's absolutely fine. Some parents do, and that's also absolutely fine. So if it's something that soothes them, you should absolutely use it if the parents are happy. It might be that they've got a little blanket that they love that has the smell of their mum on it or something like that. You might want to use that. And also sucrose, which is basically just sugary water, that helps relax little babies, makes them feel, you know, that little bit of sugar makes them feel good. I mean, probably it's not very good long term to be giving children sugar, but if it's just a very one-off, it can help soothe them. So these are the things that we would use to do an x-ray on a neonate or a newborn. Okay, so moving on to an older child, so from like 6 months, sometimes children can become quite wary of strangers. You might notice it in your own not your own children, but your own maybe nieces or nephews, that they start becoming a bit strange because they're becoming much more aware. So that's when the role of the parent or the carer is really, really important. We have to give the parents their place. We cannot think that we know better than the parent for their child. And I've found in the past that sometimes that can happen. I don't know if it's because people are rushing to get through, or people are so experienced in radiography, paediatric radiography, they think that they know better. And they might know better technically, obviously, but they don't know what's best for that child. The parent or the carer knows what's best for that child. So I'm really, I think it's really important to make sure that you're asking the parent, well, how do you think they like to be held, or what do you think would help soothe them? It could be that you use bubbles. Sometimes we put on music. Sometimes we just get out the iPhone and put on Peppa Pig and let them look at the colours and the noises. All of those things really help to soothe a young child if you're having to x-ray, you know, depending on what part of the body you're x-raying. Moving on to an older child, so from about 18 months to about 3 years, the child tends to become much more curious and interested about what you're doing, and that can be really, really fun, but it can also go either way. So they're either going to be really engaged and happy and wanting to sort of play, or they could be terrified and hold on to their mum or dad or carer and really not want any part of this. So it's important to understand that. It's also important to understand that although they might not be talking, they're understanding much more than you think. So be careful about the words that you use around them, the tone of your voice, your body language. Make sure it's open, welcoming, not tense or anxious. Distraction techniques are again really, really important. So YouTube, can't really stress enough how much we use things like that. And also gamification. So things like, you know, saying to a wee kid, are you really good at climbing? I heard you're really good at climbing. Why don't you climb up on this table and show me? And suddenly they're like, oh yeah, I'm really good at climbing. I'm going to show you that. And they start climbing up. So little games that you can create, you know, can you show me the light, and you put on the light for the X-ray tube, or show me where the middle is and you point to the middle of the collimation, or anything like that. Kids want to join in, and they want to be part of this sort of game that you're creating. It's also really, really important, as I said, to be conscious of the impact of your actions. So restraining a child really would be a last resort. Sometimes we have to do that if the need sort of if they need to have the x-ray. But really we don't want children to be screaming and being upset and to really be getting traumatized. We want to make it as pleasant as possible for them. Okay, so as they get a little bit older, to like 3 years old to 6 years old, they're starting to understand what it means to be in hospital. They're starting to understand, what does it mean to maybe be unwell, and they're starting to realize that there's certain people who are trying to help them to become better. So they are looking to trust you, and they're looking to engage in conversation with you. And that's a really good thing, because now you can start to really give them choices. So if you give children choices, it helps them make them feel a little bit more safe. It helps them feel a little bit more in control. So it's really, really important to say things like, would you like to have this x-ray? Would you like me to just get this little apron and pop it around your waist? Things like that, so that they feel like they are in control of the situation. Again, you have to be very, very mindful of your language and the things that you're saying around them. You don't want to say anything that is going to upset them. Even something really as simple as saying, oh, you need to take a picture of this because if it's broken, you might need an operation. And that sounds really daft, but people do say stuff like that to like 5-year-olds, and they understand that what that can mean, and then it can upset them, and it can means a whole conversation for the parents that they didn't really have to have, especially if they don't need the operation. So being very mindful of your language around children is so important. Again, the parent's role is important. We're going to talk to the parent, ask the parent, what do you think is best? How do you think we should do this? How will they be most cooperative? But then really we should be asking the child as well, because they're at an age where they can have input. Again, YouTube distraction techniques are very helpful. Okay, so 6 to 12 years is when it starts to become a little bit more tricky, because some maybe 8-year-olds are very, very mature for their age, and some 8-year-olds are much, much younger. So it really can vary depending on the child. And quite often at this age, the child maybe wants to look brave and doesn't want to admit that they feel really scared, and that's really, really hard, because sometimes you can really see it in their eyes that they are very, very scared, especially children who are going through chemotherapy or they're going through sort of long-term illness. So it's really important to engage them through conversation, give them choice, let them take ownership of what's going on. Don't force things upon them. Don't say, right, we have to do this, we have to do that. Just say, okay, well, would you like to do this? Would you like to do that? And it's amazing how just changing that wee word can help diffuse situations. It's also important at this age they start to become a bit more body conscious. So, it might be that an 11-year-old girl, if she wants, she has to have a chest x-ray and take off her bra, she might be very conscious if there's other people around. Things like that, you just have to be really aware of. Children then become much more easily embarrassed at this age. So you don't want, obviously, to cause them any embarrassment. If they are uncooperative, it's really important to discuss why. So it's important just to say, well, why is it that you don't want to do it? What is it that you're worried about? And then say, well, can I explain to you why I think we should do it, and have that open conversation. And this is when patience really comes in, because in adults, you just probably wouldn't maybe invest as much, although maybe some people would. But in children, we do tend to invest a lot of time, because it has that long-term impact. If we have bad experiences at a young age, that is going to follow them right all the way through into adulthood. So we really want them to trust health professionals from the get-go. It's also a good idea to try and find some common ground. So, try and be aware of, what kids are into these days. What are kids watching? Maybe ask them what kind of music they like, all that kind of thing, just so that they start thinking, well, they've got a little bit in common with you. Okay, so that flies when they're age 6 to 12, but then when they become teenagers, there's no point in trying to pretend that you're one of them, because they can spot you a mile off. So the best thing to do is when they're teenagers is really to be upfront with them. Don't lie and don't be condescending. Treat them, as they are, which really is young adults, when they get to kind of 13, 14, 15. Read the room. So if they're not in the mood to have any general chit chat, I would just crack on, because you do find with teenagers that they almost start to, sorry, I don't know, that wee image just popped up there. So with teenagers are actually obviously going through puberty, and their brain is actually going through a whole new sort of synaptic pruning. Essentially, it's getting rid of the stuff that it doesn't need. It's building on new stuff. Its emotional intelligence is lacking. So you do often find that teenagers come in quite grumpy, not really engaged. And that's not all teenagers, don't get me wrong, we get plenty of lovely teenagers, but quite often they just don't want to be there because they can't be bothered, which is fair enough. So it's just something to be aware of. They also might have body issues, and they might also be scared, and they might also be hiding it because they feel that they're older. It's important to remember that some teenagers will come in and they will be dealing with different issues. So it might be that they're pregnant, even though they're under 16. It might be that they're coming from maybe a young offenders institution, or maybe they've been fighting and they've hurt their hand, or there's lots of different sociological issues that they can be dealing with, and it's just really important to be non-judgmental when you approach that situation. Okay, so in terms of parents and carers, that actually can be the hardest part of working in paediatrics, is interacting with the parents. You know, being in hospital for any parent is, I'm guessing, I'm not a parent, but I'm guessing is their worst nightmare. And emotions can run really, really high, and patients can be up to high dole because parents can be up to high dole because they don't know what's wrong with their child. So it's really, really important to remember that probably this is one of the worst days of their life. You know, and that really doesn't mean that it's because their child is incredibly ill, but it could be that, you know, their child has just broken a bone, but this is the first really serious thing that's happened to their little one, and it's really, really traumatic for the parents. So it's really, really important to always, always remember that when you're dealing with parents and carers. You know, all these illnesses and broken bones and injuries, they're all relative. So sometimes we can become almost disillusioned as healthcare workers, and we think, oh, well, we've only got a broken wrist, you know, it could be worse. But actually to that parent, it's a really big deal. So it's really important to remember that. It's really, really important to give them their place. Never think that we know more than a parent, okay? Because it's really, really important to recognise that they know what's best for their child. So yeah, treat their child as you would want your child to be treated, or your niece or your nephew or your friend's children, whoever it might be. It's really, really important to remember that the parent should always have their place, and that they should always have an input in what you're doing. They know their child better than you. I've said that a few times, but it is really, really important to remember. Ask their advice as to what they think will work. Compliment them on their child. So, you know, everyone loves to hear that their child is cute, their child is smart, their child is, you know, whatever. So that's a really good way of getting parents on side, especially parents who maybe are maybe a little bit more standoffish, which does happen for whatever reason, or parents who are just at their wits' end because they're maybe not sure what's going on with their kid and all that kind of thing. So really try and get them on side. If they want to voice their fears, by all means, you know, listen to them and be empathetic, but always try and direct them away from the earshot of the child, especially if it's a child, you know, who maybe is a little bit younger but can kind of understand. You know, you don't want the child to be hearing things that's going to upset them in that moment. And then empathy. So empathy is really important in healthcare. You know, we talked a lot about that last year when you were in first year, but in paediatrics, especially when dealing with parents, it's so important to try and understand and try and not be judgmental and be patient of the parents' emotions and not just the child's emotions. Okay, so we're moving on to radiation protection. So obviously radiation protection is a big part of radiography in adults and in children, but in children we have to remember that their cells are growing much more quickly than they do in adults. So this means that they're much, much more sensitive to the damage that radiation can have because they are growing and multiplying much quicker. They then are much more susceptible to radiation damage. Also, children have hopefully a longer life expectancy. So they have many more opportunities to be exposed of radiation to radiation in the future, and that means they then have a higher risk of cancer due to radiation exposure. So we have to remember that. They've also got smaller body parts, so when you x-ray a little neonate's chest, it's very hard not to include a little bit of their abdomen because they're so close together. So we have to make sure we're collimating in as tightly as possible to try and make sure that we're not exposing body parts unnecessary. Even if you're trying to x-ray a 2-year-old's finger, it's really hard not to get the hand and the wrists included because they might be moving, and also the body parts are so small, like I said, that it's difficult to just focus on one part. So obviously we have to make sure that we are always adhering to a LARA or a LARP, whatever you want to call it, as low as reasonably achievable. So that's really just as important as it is in adults in paediatrics. We also make use of lead protection, so we'll be using gonad protection, we'll be putting on lead coats if we can, or lead aprons. Obviously, justification is incredibly important, just as it is in adults. So, you know, does this, has the clinician provided rationale for this x-ray? And it could be sometimes that they'll ask for things that aren't appropriate. So they'll ask for a scaphoid x-ray in a child who doesn't yet have a scaphoid. So things like that you have to be very careful of. You also have to make sure that the x-ray requests are aligning with your policies and your protocols within your department. You also want to do minimal repetition of x-rays, so you want to make sure that you're not just repeating things for the sake of it, and that's obviously the same in adults as well, but more important in paediatrics. Don't just repeat something because you think, well, it's not perfect. Does it answer the question? If not, if in doubt, you would check with a radiologist. You know, I know this isn't perfect, but can you see what you need to see? They might say, no, repeat it, or they might say, yeah, I can see what I need to see, so you don't have to repeat it. Also in paediatrics, we do rely heavily on other imaging modalities, which we're not going to talk about today because this is part of the RP module, but MRI plays a massive part in imaging children, and so does ultrasound. Okay, so that's the end of part 1. I hope it's given you a good overview of the paediatric environment and how we sort of get children to cooperate with us. The next part we'll look at the skeleton very, very briefly because this is not an anatomy lecture, you'll be happy to know. And then we'll start looking at some techniques that we use in paediatrics and some common pathologies.